A woman sat in my office once and described something she almost didn't mention at all because by the time she saw me, it was already gone. 2 weeks earlier, for about 90 seconds, the vision in her right eye had simply gone dark, like someone had pulled a curtain down over it. Then it lifted, her vision returned completely normal, and she went on with her day. No pain. No other symptoms. She almost didn't tell anyone because how do you explain something that fixed itself in under 2 minutes? I want you to remember her story for the next 20 minutes because what I found when we investigated further is exactly why I made this video, and it may be the single most important thing you watch this year. I am Dr. James Parker, and here's the fact I need you to sit with before we go any further. A major stroke, the kind that changes or ends a life in an instant, is very often not the first sign your brain gives you that something is wrong. In a significant number of cases, the brain sends out a warning days, sometimes weeks, before the real event. A brief, temporary episode that looks almost exactly like a stroke, lasts anywhere from a few seconds to several minutes, and then completely disappears, leaving you looking and feeling entirely normal afterward. This is called a transient ischemic attack, or TIA, and it is, without exaggeration, one of the most under-recognized warning systems in all of medicine, because the very thing that makes it feel harmless, the fact that it resolves on its own, is exactly what makes it so dangerous to ignore. Today, I'm walking you through 5 specific warning signs your body may give you in the hours or days before a stroke. Signs that are frequently dismissed, misunderstood, or simply forgotten because they didn't stick around long enough to feel serious. I'm also going to explain exactly what's happening inside your brain during each one, what's driving the underlying risk, and the 3 specific medical tests worth discussing with your doctor if any of this sounds familiar to you. Stay with me through the entire list, because understanding all 5 together, rather than any single one in isolation, is what gives you the clearest possible picture of your own risk. Before we start, if you watched my last video on what it means if you wake up with a dry mouth almost every single morning, a signal almost nobody connects to what it's actually telling them, you already know this channel is about catching the quiet warnings your body gives you before they become something much bigger. This video takes that same idea and applies it to something that can be genuinely life-threatening within hours if missed. Let's get into the 5 signs. Sign number 1 is temporary blindness in one eye. This is a specific, distinct experience, and it's worth understanding exactly what it feels like so you can recognize it if it ever happens to you or someone you love. One eye suddenly goes dark, blurry, or feels as though a curtain or shade has dropped over part or all of your vision in that eye, while the other eye continues to see completely normally the entire time. Then, after anywhere from several seconds to a few minutes, the vision returns, often completely, leaving no lasting trace at all. This specific phenomenon has a medical name, amaurosis fugax, and it happens when a tiny clot or a small fragment of plaque temporarily blocks blood flow to the retina, the light-sensing tissue at the back of the eye, before that blockage clears or dissolves on its own. The reason this matters so much is that the blood vessel supplying your retina is directly connected to the same vascular system supplying your brain. A tiny clot capable of temporarily blocking that vessel to your eye is entirely capable of doing the exact same thing to a vessel in your brain, and the fact that it happened at all tells you something concerning is circulating through your bloodstream, whether or not it happens to hit your eye or your brain on any given occasion. This specific symptom is one of the clearest, most recognizable signals of a possible TIA and meaningfully elevated stroke risk, precisely because the eye offers such an obvious, noticeable warning that something is temporarily blocking blood flow somewhere in that shared vascular system. Sign number 2 is sudden one-sided numbness or tingling. This shows up as an unexpected pins and needles sensation, numbness, or genuine weakness affecting only one side of the body, and it can involve an arm, a hand, one side of the face, or the entire side of the body all at once. The critical detail that separates this from something harmless is the absence of an obvious cause. We've all experienced an arm falling asleep after lying on it awkwardly, and that sensation makes complete sense once you notice the position you were in. This is different. It appears suddenly, with no positional explanation, no obvious pressure on a nerve, nothing you did that would reasonably explain why one side of your body suddenly feels wrong. What's actually happening in this scenario is a temporary disruption of blood flow to the specific area of your brain responsible for processing sensation from that side of your body. Because different regions of the brain control sensation for different specific parts of the body, the exact pattern of numbness, whether it's just a hand, an entire arm, part of your face, or one whole side, can actually help a doctor localize which area of the brain was briefly affected, which is exactly why describing the pattern precisely matters if this happens to you. Sign number 3 is sudden loss of coordination or balance, and this is one that gets dismissed constantly, often blamed on tiredness, an inner ear issue, or simply not paying attention to where you're walking. The experience itself is distinct enough that most people, in the moment, know something is genuinely wrong, even if they talk themselves out of it afterward. It can feel like suddenly walking as though you were intoxicated, staggering unexpectedly, veering to one side without meaning to, misjudging where to place your feet, or experiencing an intense, unexplained wave of dizziness that comes on abruptly rather than building gradually. This particular symptom is connected to a specific part of the brain called the cerebellum, along with a network of blood vessels known as the vertebrobasilar circulation, both of which are heavily involved in coordinating balance, movement, and spatial orientation. A brief interruption of blood flow through this specific circulatory pathway can produce exactly this kind of sudden, unexplained coordination problem. And because it resolves, and the person can typically walk normally again within minutes, it's one of the most commonly explained away symptoms on this entire list. Sudden, unexplained balance problems with no clear cause, particularly if they resolve on their own, deserve to be taken seriously as a possible TIA rather than brushed off as simply a strange, isolated moment. Sign number 4 is sudden speech problems. And this one can present in 2 genuinely different ways, both of which are important to recognize. The first is a sudden difficulty getting words out properly, where speech becomes slurred, broken up, or physically hard to produce, even though the person clearly knows exactly what they want to say. This is often connected to a brain region called Broca's area, which plays a central role in the physical production of speech. The second, less commonly recognized pattern involves someone speaking fluently, with normal-sounding rhythm and pronunciation, but the actual content of what they're saying comes out confusing, jumbled, or doesn't make logical sense, even though from the outside it may sound like normal speech at first. This pattern is often connected to a different brain region called Wernicke's area, which is more involved in language comprehension and meaning rather than the physical mechanics of speech production. Because these 2 patterns look and sound so different from each other, sudden speech disturbance is sometimes misunderstood entirely, with people assuming that if speech still sounds fluent, nothing could really be wrong. Both patterns represent the same underlying concern, a sudden disruption of blood flow affecting the specific brain regions responsible for language, and both deserve exactly the same level of urgency, even if the episode passes and speech returns to completely normal within minutes. Sign number 5 is the most unusual entry on this entire list, and I want to walk through it carefully because it's a genuinely underappreciated connection. New, unusually intense headaches occurring alongside vitiligo, the autoimmune condition that causes patches of skin to lose their natural pigment. On the surface, these seem like 2 completely unrelated things, a headache and a skin condition. The connection lies specifically in inflammation. Vitiligo is fundamentally an autoimmune process, and autoimmune activity of this kind has been associated with broader inflammation that can, in some cases, extend to involve the lining of blood vessels themselves, not just the skin. When blood vessel lining is affected by ongoing inflammatory activity, this can meaningfully contribute to an elevated risk profile for vascular events, stroke very much included. A new headache pattern on its own, especially one that feels different, more intense, or more persistent than any headache you've previously experienced, is always worth mentioning to a doctor. When that new headache pattern occurs in someone who also has vitiligo or any other autoimmune condition involving vascular inflammation, it's worth being evaluated with that broader inflammatory picture specifically in mind, rather than assuming it's simply an ordinary headache with no deeper connection to anything else happening in the body. Now, let's talk directly about what a TIA actually is, because understanding this properly ties every single one of these 5 signs together. A transient ischemic attack is a temporary interruption of blood flow to a specific part of the brain, different from a full stroke specifically, because the blockage clears or dissolves before it causes permanent, lasting damage to brain tissue. The defining features are exactly what we've seen across all 5 signs today. The symptoms appear suddenly without warning. They can last anywhere from a few seconds to several minutes, occasionally longer, and then they resolve completely, often leaving the person feeling entirely normal again within a short period of time. Here is the single most important thing I need you to take from this entire video. The fact that a symptom disappeared does not mean it wasn't serious. A TIA is, in a very real sense, your brain's own early warning system, a preview of exactly what a full stroke would look like without the permanent damage, and a significant percentage of people who experience a full stroke had one or more of these transient warning episodes in the hours, days, or weeks beforehand, episodes that were dismissed, forgotten, or never mentioned to a doctor at all. Understanding why these episodes happen in the first place means understanding what's damaging blood vessels over time in the background. Several factors contribute meaningfully to this kind of vascular vulnerability. High blood sugar and insulin resistance damage the delicate inner lining of blood vessels over years of exposure. Smoking directly injures blood vessel walls and accelerates plaque formation throughout the circulatory system. High blood pressure places continuous excess mechanical stress on vessel walls, making them more prone to damage and rupture over time. Plaque buildup, medically known as atherosclerosis, narrows arteries and creates the exact kind of surface that small clots or fragments can break off from. Atrial fibrillation, an irregular heart rhythm, allows blood to pool and clot within the heart itself, with those clots then capable of traveling directly to the brain. Simple age-related changes to blood vessels, becoming stiffer and less flexible over the decades, contribute to overall vulnerability as well. Certain autoimmune conditions, as we discussed with vitiligo specifically, can involve inflammation that affects vessel lining directly. And in younger people experiencing these kinds of warning signs, other less common causes are worth investigating, including structural vessel abnormalities present from birth and various clotting disorders that increase the tendency for blood to form clots inappropriately. If any of today's 5 warning signs sounds familiar, either something you've experienced yourself or something you've noticed in someone you love, there are 3 specific evaluations worth discussing directly with your doctor. The first is a carotid duplex ultrasound, a non-invasive imaging test that examines the 2 major arteries running through your neck, checking specifically for plaque buildup and any narrowing that could be a source of clots traveling toward the brain. The second is an HbA1c blood test, which measures your average blood sugar over roughly the past 3 months, rather than a single moment in time, making it particularly useful for identifying prediabetes or diabetes that may be quietly damaging blood vessels in the background without any other obvious symptoms. The third is Holter ECG monitoring, where you wear a small heart rhythm recording device for an extended period, often 24 to 48 hours or sometimes longer, specifically because atrial fibrillation can be intermittent, coming and going, and a brief single reading in a doctor's office can easily miss it entirely if it happens to occur at a different time. Now, here is exactly what to do if you or someone you love experiences anything resembling these 5 warning signs. even if it resolves completely within minutes. Do not ignore it simply because it went away on its own. Seek urgent medical evaluation as soon as possible, ideally through emergency services rather than waiting to schedule a routine appointment, since determining what actually happened and whether it might happen again imminently and more severely requires prompt medical assessment. Do not drive yourself to get evaluated if you're experiencing these symptoms in the moment. Call emergency services instead, since your coordination, vision, or cognitive function may be affected in ways that make driving genuinely unsafe. Do not start aspirin or any other blood-thinning medication on your own, even though this is sometimes recommended in a true stroke emergency, because the appropriate treatment depends entirely on whether the event is caused by a clot-blocking blood flow or by bleeding within the brain, and taking a blood thinner in the wrong scenario can make a bleeding-related event significantly worse. This is exactly why brain imaging, generally a CT scan or MRI, is essential, since it's the only way to reliably distinguish between an ischemic stroke caused by a blockage and a hemorrhagic stroke caused by bleeding, and the correct treatment path depends entirely on which one you're actually dealing with. And finally, once you're safely past the immediate event, have a genuine conversation with a healthcare professional about stroke risk testing and prevention, including the 3 evaluations we just covered, so that any underlying issue can be identified and addressed before a more serious event has the chance to occur. Here is the message I most want you to walk away with today. A stroke does not always happen without warning. In a meaningful number of cases, your body sends a preview first, a brief temporary episode that mimics exactly what a full stroke would look like, then resolves and disappears, often within minutes. Temporary blindness in one eye, sudden one-sided numbness or tingling, sudden loss of coordination or balance, sudden speech problems, and unusual new headaches, particularly alongside a condition like vitiligo. None of these should be dismissed simply because they went away. The disappearance of a symptom is not the same as the absence of danger, and recognizing that distinction and acting on it quickly is genuinely one of the most important pieces of medical knowledge I can share with you. If this video gave you information that could genuinely protect you or someone you love, take a second and tap that like button. It helps this reach more people before their own warning moment arrives. And tell me in the comments, has anything like these 5 signs ever happened to you or someone in your family, even briefly? I read every comment, and it shapes exactly what I bring you next. Before you go, if today's video changed how seriously you'll take a brief, unexplained symptom, my last video covers a different kind of quiet warning sign, one that shows up almost every single morning and gets dismissed just as easily. It's called, "If you wake up with dry mouth, your body is warning you." Almost nobody knows this, and it explains exactly what a consistently dry mouth in the morning can actually be telling you about your health, a signal most people write off as simply needing more water. If today's video taught you to take the small, easily dismissed signals seriously, that one belongs right alongside it. I'll leave it right here for you. I'm Dr. James Parker. Take the small warnings seriously, and I'll see you in the next one.